Hi, we're the Ningas team. Our product focuses on building a digital solution for mental health care providers. A problem that exists today is that 78% of mental health practitioners experience burnout. There's typically only one provider for over 12,000 patients, and these mental health care workers screen positive for depression 16% of the time. It's estimated that 81% of physicians in all health categories work above their capacity and feel overextended at their care practices. We wanted to address challenge number 4 and develop a tool to help improve work efficiency for mental health care providers. Our solution is a web application called Viben, which is an easy way for providers to check in on their patients offline. This is our awesome team spanning 4 different time zones. Here's what we came up with in the last 24 hours. I'll explain our product in these 3 parts. First, the product evolution, next steps, and I'll give you a demo. We started with this problem statement. Mental health providers are overstretched and feel less engaged and burnt out. Currently, this process exists, which fills up the providers' schedules. Because providers see patients in person for refills or check-ins that are unnecessary, it's time-consuming for both patients and providers. Our product, Viben, uniquely helps medical providers improve engagement with their mental health patients by rewarding them for providing responses to personalized offline check-ins. We conducted research by comparing other similar products on the market, mainly those that record patient data outside of clinic visits, but none of them offered a reward system directly from the provider. Viben's main 3 features would include the ability to check in symptoms by responding to scheduled emails, a reward system to incentivize patients to respond to questionnaires, and a symptom or mood tracker that the patient can access and monitor themselves. When mental health practitioners implement Viben into their care routines, the journey now looks like this. The patient submits their check-in before the next visit, and depending on the response, the provider can schedule the next visit accordingly, perhaps sooner or later. That way they can reserve in-person visits for more than just medication refills or checking if medicine or treatment is working. We can measure the success of Viben based on how many patients engage with the platform and whether or not there is reduced frequency between patient follow-up visits. That will indirectly reduce the workload of the providers. In the future, Viben could have these other capabilities, including integration with the hospital electronic record software. We can also integrate AI or machine learning features to generate questionnaires. We can eventually do language translations to help non-English speaking communities, and even expand to use Viben in other medical specialties. For the pricing model, we thought of doing a licensing model with providers. They could buy the integration with their hospital electronic record systems. Now I'll give you a quick demo of our product. Here's a look at what the patient sees after they open the link sent to them via email. First, they enter their personal dashboard, and from here they click Get Started to begin the questionnaire. All of the questions are multiple choice, making it easy for patients to answer. We encourage doctors to limit the number of questions to less than 5, so patients don't feel overwhelmed to finish it. The idea is not to replace the patient's interview in person, but to help guide the doctor and give them a status update, which they can use during their next face-to-face interview. Once the patient has completed the questionnaire, they'll see a confirmation page showing how many points they've accumulated and how far they are from redeeming one of the rewards chosen by the provider. Patients can also see the rewards catalog from here or the dashboard, which updates them on how many points they've already earned and feel excited by the rewards they can receive in the future. We also want to share what the provider's dashboard looks like, even though we didn't have time to build out the prototype for their flow. Here, the doctor can schedule the check-ins before the patient's next visit and review their responses. Doctors can also choose between 3 to 5 questions for each patient from a question bank for easy input, or write up their own questions. Our goal, though, is to reduce extra work doctors need to do So having selectable options is our solution to allow them saved time and mental effort. We know that at least in the US, there is no limit to how many patients doctors can schedule in a day. So it's up to providers to use any saved time to recuperate and not just schedule more patients, or else the cycle of burnout will continue. Thank you so much for listening, and we hope you like our presentation.